Attention all dentists, surgeons, hospital and clinic CEOs, chiropractors, and other medical professionals in private practice who offer high-price elective procedures. I would like to invite you to a free online healthcare executive briefing and webinar. The information you will learn during this executive briefing, if applied, can help you increase your practice revenues by 100% within just 3 years. During this short video presentation, I will provide you with information about this event and other free resources I would like to make available to you to help you overcome the following 4 negative trends affecting the profits and revenues of practices and medical groups across the country. 1. The doctor, clinic, or hospital across town may be legally stealing your prospective patients. 2. Most of your advertising and marketing may not be attracting the most profitable patients. And 3 and 4, if that weren't bad enough, according to IMS Health, patient office visits have fallen by more than 10% since 2007, while practice costs have risen sharply. During our free executive briefing, you will learn some new strategies and tactics to reverse these 4 negative trends. Let's discuss these challenges. The market for high-priced elective procedures is getting smaller. If the number of inpatient office visits is decreasing, then revenue is decreasing for many practitioners. So how do you expand, capture more market share, and grow your practice when the pie is getting smaller, not bigger? The cost of delivery is increasing. Across the board, it costs more than ever before to provide quality health care to patients. One key component of your cost structure is advertising and marketing. The cost to acquire a patient has tripled over the last 10 years because many advertising options are overly expensive and frankly most don't work. The ones that do produce results usually attract cash-strapped patients without the resources to invest in high-priced elective procedures. In this highly competitive environment, how do you attract patients who can afford your procedures, increase your case conversion rates, and maintain respectable margins? Yes, it's true. Another doctor across town or next door may be legally stealing your prospective patients. How is this possible? More than 90 million Americans have smartphones, which means there are 4 times as many smartphone users as PC owners. Imagine what happens when a prospective patient searches for dental implants or breast augmentation on their mobile phone and arrives at your website that looks quite unprofessional on a mobile device. The answer is simple. They leave and search for another dentist or cosmetic surgeon who has a website that is easy to navigate and read on their smartphones and tablets. Every time this happens, a doctor across town or right next door gains a new patient that could have been yours. If this happens at least once per month, you could be missing out on $60,000 to $100,000 a year in revenue. Would you like to know how many people in your area are using their smartphones or tablets each day to search for a doctor like you? What are the answers? What is the solution? Hi, my name is Samuel Salter, and I have some answers to these pressing questions and concerns affecting your practice's ability to grow and profit. I am an author, digital marketing strategist, successful serial entrepreneur, former venture capitalist, management consultant, CRM, and marketing automation consultant. My journey began when I was 18 years old. With street smarts gleaned from Newark's inner city, I started a mortgage company with only $500 of seed capital. Less than 2 years later, I had a multi-million-dollar enterprise. This success led President Ronald Reagan and the U.S. Small Business Administration to grant me the first ever Young Entrepreneur Award in 1984. As a highly paid and sought-after management and digital marketing consultant, I advise hundreds of business owners, CEOs, and vice presidents of sales and marketing about how to optimize all aspects of their sales and marketing processes to increase revenues and net profits. At the invitation of Myron Ullman, CEO of JCPenney, I served on the board of Mercy Ships, an international charity that operates the world's largest hospital ship. I have been featured in the New York Times, People magazine, and have appeared on Good Morning America and the Financial News Network, the predecessor of CNBC. As CEO of more B2B and big-ticket consumer sales, I help private practices, clinics, and hospitals use digital and direct marketing to sell more high-price, elective procedures to affluent consumers and obtain more physician referrals. I would like to offer you my free Healthcare Mobile Revenue Kit. This kit is your first step to have an insight into some real solutions to these mounting concerns and real issues affecting your practice's ability to grow and profit. What is included in your free Healthcare Mobile Revenue Kit? I could easily sell the 2 live one-on-one executive briefings and webinars, the Anatomy of a Modern Practice DVD, competitor analysis, and the other materials in the kit for at least $2,168.98. But today, you can get this practice growing and revenue generating information for free. Here is what you will receive. 1. My Affluent Patient Attraction Assessment Mobile Edition, valued at $85. To sell more high-priced elective procedures, you have to attract more affluent patients to your practice. Your message, advertising, and marketing have to start focusing on the top 20% of the market. Is your practice ready and positioned to attract affluent patients who are highly connected to their mobile devices and computers? The Affluent Patient Attraction Assessment will provide you a clear answer to that question and let you know if your practice is really ready to attract the affluent patient. 2. Mobile Money. Mobile Money is an online one-on-one executive briefing and webinar. This consultant session is valued at $400. During this 1-hour session with one of our healthcare digital marketing strategists, you will learn about the tremendous opportunity mobile marketing and mobile technologies present to the healthcare industry. Mobile is revolutionizing the marketing and delivery of healthcare services. Mobile technologies allow you to provide an extraordinary level of patient care. During this 1-hour educational session, we will open your eyes to what is possible from a patient care, healthcare mobile marketing, and revenue generation standpoint. 3. A personalized healthcare mobile revenue profitability assessment and competitive analysis. This is a one-on-one executive briefing and webinar. This consultant session is valued at $800. During this second one-on-one executive briefing and webinar, your digital marketing strategist will explore with you how your practice is positioned against your competitors in your local area to capture the dollars and minds of digitally connected affluent consumers. 4. You will receive our special report entitled Mobile Money Healthcare Edition: How to Use Mobile Marketing to Sell Elective Procedures to the Affluent. Value $97. This special report is a quick read and summary of the Mobile Money Executive Briefing and Webinar. Its pages are packed with ideas, strategies, and tips on how mobile marketing can help you attract more affluent patients and how mobile technologies can provide a better patient experience. 5. a local healthcare competitive analysis of the number one practice in your area. Value $500. Frankly, if you are the number one practice in your area for your specialty, then you are not going to like this part of the package. You will receive a complete competitive analysis of the number one practice in your area, in your specialty. Our internet spies have uncovered the internet marketing strategies. We share with you their marketing strengths and weaknesses and what you need to do to beat them and dominate your local market and become number one or at least number two. 6. Anatomy of a Modern Practice DVD. Value $197. What does a modern, mobile, and digitally connected practice look like? How does it operate? How does it interact with patients? How does it use mobile and internet marketing to attract more patients from the surrounding area than any of its competitors? How does it use mobile technologies to provide an amazing patient experience and care? This DVD will take you into the future and show you what a modern practice will look like and how it will operate. The total value of your free healthcare mobile revenue kit is $2,168.90. We know healthcare practitioners can get really busy. As an added incentive to encourage you to attend both webinars, after you complete the second webinar, you will receive a free universal cell phone charger valued at $39.95. As a doctor, you never want to risk having a dead cell phone. There will come a time when you will be glad you had this universal cell phone charger battery backup on hand. By now, you are starting to see the tremendous value of the healthcare mobile revenue kit and are starting to wonder what's the catch? Why so much is free? Very simple. Our mission is to educate more than 10,000 medical practice owners, CEOs, and medical sales and marketing professionals about how to create amazing customer experiences and relationships that would generate more revenue, profits, and shareholder equity. If we don't provide you with an irresistible offer and an amazing customer experience, then how can we teach you to do the same for your patients? Second, this opportunity provides a better way to generate business than hard sales pitches. By providing tremendous educational value for the healthcare community at no charge, a small number of you will be interested in discussing with us further about our services and how we can help you grow your healthcare practice, dominate your local market, and become the number one practice in your area. Enough has been said about the tremendous value of the healthcare mobile revenue kit. This program will not be free forever, so take advantage of this opportunity and register today for your one-on-one executive briefings and receive the healthcare mobile revenue kit by clicking the link appearing on this video or completing the form below.